Have you ever thought about why your blood sugar remains high even when you avoid sweets and take your medicine? The truth is, diabetes is not just about sugar or pills. It is also about the key nutrients your body needs daily. Without these nutrients, insulin cannot work properly, nerves weaken, and complications appear much faster than expected. Many people with diabetes unknowingly miss out on essential vitamins, which leaves them tired, achy, and frustrated when blood sugar refuses to stabilize. By filling this nutritional gap, you can boost your energy, improve comfort, and protect long-term health. Doctors often tell you to avoid sugar or stick with medications, but rarely explain how vitamins and minerals play a direct role in controlling blood sugar. One of the most overlooked nutrients is vitamin B6. For diabetics, this vitamin can be a game changer. High blood sugar causes the body to lose more B6 through the kidneys, while inflammation and oxidative stress force the body to use up extra B6 for repairs. On top of this, high insulin levels and common medications like metformin or blood pressure drugs reduce B6 levels even further. That is why many older adults with diabetes end up deficient in this vitamin without knowing it. The symptoms of B6 deficiency are often subtle and easy to dismiss as normal aging. Fatigue, brain fog, mood swings, tingling or burning in the hands and feet, weak muscles, and poor coordination are all possible signs. Even skin dryness, mouth sores, frequent illness, and anemia can develop. In men, low B6 may reduce testosterone and sperm quality, while in women it can cause irregular cycles and worsen PMS. It can also slow nerve repair, weaken immunity, increase kidney stress, damage the eyes, and raise heart risks by increasing homocysteine levels. Food is the best source of vitamin B6. Chickpeas, beef liver, salmon, turkey, and sunflower seeds are excellent options. For example, a meal of miso-glazed salmon with chickpeas can meet almost all of your daily needs. Supplements are also available, especially in the P5P form, which the body absorbs better. However, dosage should always be guided by a doctor. Lifestyle choices matter too. Refined grains, excess sugar, alcohol, and certain medications quietly deplete vitamin B6 reserves. For people living with diabetes, vitamin B6 may not sound impressive, but it plays a powerful role. It helps insulin work more effectively, supports nerve health, protects the heart, and steadies energy levels. In short, it is one of the most important and overlooked tools for long-term stability and comfort. Vitamin E plays a powerful role in protecting people with diabetes from serious complications. This nutrient is essential for circulation, and without enough of it, blood flow declines, something critical for sexual health and nerve function. Low levels make nerve cells more vulnerable, worsen neuropathy, and increase the risk of kidney and eye damage. In the heart, vitamin E helps keep arteries flexible and prevents cholesterol from oxidizing, lowering the risk of heart disease. At the cellular level, it acts like armor, stabilizing cell membranes, protecting fats, reducing inflammation, and improving insulin sensitivity. It even regenerates other antioxidants, like vitamin C, to strengthen the body's defense system. Fortunately, vitamin E is easy to add through food. Sunflower seeds, almonds, hazelnuts, spinach, and avocados are rich sources, especially when paired with healthy fats for better absorption. Elegant meals like almond-crusted fish, hazelnut-glazed duck, or avocado and seed-based dishes combine nutrition with flavor. Supplements are another option, but natural forms such as D-alpha-tocopherol are better absorbed. A safe daily range is 200 to 400 IU, though excess should be avoided since high doses can thin the blood. Mixed tocopherol formulas provide broader protection. Lifestyle choices also matter. Processed oils, high-sugar diets, alcohol, and overcooked vegetables deplete vitamin E, while balanced meals with light steaming help preserve it. For anyone struggling with blood sugar, nerve pain, or dry skin, vitamin E can improve circulation, strengthen immunity, and slow diabetes-related damage. Vitamin C is another crucial nutrient that diabetics often overlook. High blood sugar reduces absorption because glucose and vitamin C compete for the same entry pathways into cells. At the same time, oxidative stress and frequent urination deplete vitamin C reserves, leaving the body at risk. Deficiency may start with subtle signs such as fatigue, slow healing cuts, easy bruising, bleeding gums, dry skin, or frequent infections. Joint stiffness, iron deficiency anemia, and worsening neuropathy may follow. The impact goes further, affecting fertility, libido, kidney function, vision, and heart health, while stiffening arteries and raising inflammation. On a cellular level, vitamin C is one of the body's strongest antioxidants. It reduces oxidative stress, boosts collagen for stronger tissues and blood vessels, improves insulin sensitivity, enhances immunity, and regenerates vitamin E. Without enough, cells weaken, age faster, and become prone to complications. Thankfully, natural food sources are abundant. Kakadu plums and acerola cherries are among the richest, while red bell peppers, kiwis, strawberries, citrus fruits, and tomatoes provide excellent daily amounts. Simple additions like fresh salads or lightly steamed vegetables can raise intake. For fine dining, dishes like citrus marinated salmon, kiwi salsa with tuna, or cherry sorbet with dark chocolate bring both taste and health benefits. Supplements are another option, with liposomal vitamin C offering the best absorption. Most people do well with 500 to 1,000 milligrams daily, though higher amounts may be helpful during illness or stress. In short, both vitamin E and vitamin C are powerful tools in the fight against diabetes. Together, they protect nerves, blood vessels, immunity, and overall energy, helping the body resist complications and stay strong for the long term. Vitamin C is one of the simplest yet most powerful defenses against diabetes complications. Steaming or eating raw foods helps preserve it, while smoking, alcohol, and heavily processed diets quickly burn through this nutrient. Without enough vitamin C, the body struggles to fight infections, heal wounds, and maintain strong blood vessels. For people with diabetes, this vitamin strengthens immunity, supports collagen, reduces oxidative stress, and protects against neuropathy, kidney disease, and vision loss. If you often feel tired, heal slowly, or face frequent infections, adding vitamin C-rich foods or a quality supplement may be the missing link to restoring strength and stability. Vitamin D, often called the sunshine vitamin, acts like a hormone and is far more important than most realize. For seniors with diabetes, it supports insulin sensitivity, immune function, bone health, and inflammation control. Unfortunately, aging skin produces less vitamin D, kidneys activate it less efficiently, and lifestyle changes keep many indoors. Early signs of deficiency include fatigue, muscle weakness, bone aches, and mood changes such as irritability or sadness. Left uncorrected, it can lead to brittle bones, poor balance, unstable blood sugar, and higher risks of infection, heart disease, kidney damage, and nerve pain. Vitamin D works at the cellular level to make insulin more effective, regulate calcium for nerves and muscles, and speed up repair and recovery. Food sources like salmon, sardines, egg yolks, and fortified milk are helpful, but sunlight exposure and supplements are often necessary. Vitamin D3 is the best form, with 1,000 to 2,000 IU per day common for older adults. Restoring this vitamin can dramatically improve energy, mood, and overall resilience. Magnesium is another overlooked mineral that plays a central role in blood sugar control. It helps insulin move glucose into cells, but when levels are low, insulin resistance worsens and blood sugar rises. Many seniors are deficient due to modern diets and diabetes medications that flush magnesium from the body. Early signs include poor sleep, restless legs, muscle cramps, anxiety, and trouble concentrating. As deficiency deepens, irregular heart rhythms, high blood pressure, headaches, and worsening insulin resistance appear. Magnesium supports the heart by relaxing arteries, steadies the nervous system by calming signals, protects kidneys from calcium buildup, and strengthens bones. It also powers enzymes that generate energy, ensuring glucose is used efficiently instead of lingering in the blood. Rich sources include leafy greens like spinach, nuts, seeds, beans, and whole grains. Even simple habits, oatmeal for breakfast, spinach salad at lunch, or a handful of nuts as a snack can raise magnesium intake. For diabetics, restoring magnesium levels can reduce cramps, improve sleep, lower blood pressure, and make insulin more effective. After finding out that his body was low in magnesium, William made simple but powerful changes. He started eating more greens, nuts, and beans, and with his doctor's advice, added a magnesium supplement. Within a few weeks, his muscle cramps eased, his energy returned, and his blood sugar became easier to control. His story reminds us how just one missing mineral can affect so many areas of health. For older adults, magnesium is especially important. It supports steady blood sugar, calms the nerves, strengthens bones, and improves sleep. Supplements like magnesium citrate or glycinate are usually better absorbed, with safe amounts ranging from 200 to 400 milligrams daily. But it's always best to confirm with a healthcare provider, since too much can cause digestive problems. Unfortunately, many habits drain magnesium from the body. High-sugar diets, caffeine, alcohol, stress, and even some common medications like diuretics or antacids. Processed foods make matters worse by stripping away natural minerals. While magnesium may not be as popular as vitamins D or B, its role in diabetes health is powerful, giving seniors steadier energy and stronger muscles for everyday life. Another key support for seniors with diabetes is alpha-lipoic acid, also known as ALA. It isn't a vitamin, but a strong antioxidant that works alongside nutrients to protect the body. For those with diabetes, it can improve insulin sensitivity, lower oxidative stress, and most importantly, protect nerves. Low levels often show up as burning, tingling, numbness, fatigue, or brain fog. Since ALA levels decline with age, older adults often benefit from extra support through food or supplements. Foods like red meat, spinach, broccoli, and tomatoes contain some ALA, but usually not enough to reach therapeutic levels. That's why supplements are often recommended. Studies show that 300 to 600 milligrams daily can reduce nerve pain and improve blood sugar control, though seniors should always check with their doctor, especially if already taking diabetes medications. We then have omega-3 fatty acids, famous for heart health, but equally vital for people with diabetes. They reduce inflammation, improve insulin function, and protect nerves, eyes, kidneys, and blood vessels from damage. Signs of low omega-3 include dry skin, brittle nails, stiff joints, mood changes, and rising triglyceride levels. The best food sources are fatty fish like salmon, sardines, and mackerel, while plant-based options include flax seeds, chia seeds, and walnuts. For many seniors, adding fish to the diet or taking fish oil supplements can bring noticeable improvements in blood sugar, circulation, and nerve pain. Together, these three, magnesium, ALA, and omega-3s, form a powerful trio for seniors managing diabetes. They restore balance, protect vital organs, and bring back comfort, confidence, and energy in daily life. After just a few months of adding omega-3s to her diet, Patricia noticed her blood lipids improving, her nerve pain easing, and her balance becoming steadier. Her story reflects what research shows clearly. Omega-3 fatty acids are powerful allies for seniors living with diabetes. While fatty fish, flax seeds, and walnuts provide some, supplements like fish oil, krill oil, or algae-based capsules are often needed to reach effective levels, usually around 1 to 3 grams daily. Choosing high-quality products tested for purity is important, but diet and habits matter too. Processed foods, oils high in omega-6, smoking, alcohol, and chronic stress can block their benefits, fueling inflammation instead of calming it. By making better choices, omega-3s can protect the heart, nerves, eyes, and kidneys, while supporting insulin function, mood, and overall energy. Zinc is another nutrient often overlooked but essential for diabetic seniors. Though it's needed only in small amounts, its role is massive, supporting wound healing, immune defense, nerve repair, vision, and even how insulin works in the body. Sadly, aging, medications, alcohol, and processed diets often lead to deficiency. Early signs include slow healing cuts, frequent infections, weaker taste or smell, brittle nails, or poor healing of foot wounds. Over time, fatigue, vision problems, or mood changes can appear. Foods like oysters, beef, poultry, beans, lentils, and pumpkin seeds are excellent sources, while supplements such as zinc gluconate or citrate may help when diet isn't enough. Most seniors do well with 15 to 30 milligrams daily, but balance is important since too much zinc can block copper absorption. The bigger picture is clear. Living with diabetes isn't about a failing body, but about missing tools. Nutrients like magnesium, ALA, omega-3s, and zinc don't work like magic pills. Instead, they quietly help insulin function, repair nerves, strengthen blood vessels, and restore steady energy. Aging and diabetes both drain these resources, which is why being mindful of nutrition is essential, not optional. The good news is you always have choices. Through balanced meals, thoughtful supplements, and small lifestyle changes, you can lighten the weight diabetes puts on your body. Every small adjustment adds up to better days, fewer complications, and more independence. You deserve strength, stability, and peace of mind, and it's never too late to begin.